Okay, so now we're gonna continue and we're gonna be doing respiratory system now. So what I'm gonna be asking my patients, you're gonna hear me say terms like palpating and then asking her to take deep breath. I'm gonna be listening to her lungs, anterior and posteriorly. I'm gonna be listening to on both sides, right and left lungs. And on the right side, there's three lobes, so you'll see me listening on upper, middle, and lower. On the left side, there's only two lobes, so you'll be mostly like upper and lower. Okay? All right. Are you having any difficulty breathing?
No.
Does it hurt when you take a deep breath?
No.
Okay. What I'm gonna ask you to do right now is to remove part of your gown so that I can inspect your skin, your muscles, and chest, and then palpate. So palpating is just me touching your chest. Okay? All right. So I'm palpating, making sure there is no lump. There's no lump, and it doesn't hurt when I do this. Does it hurt when I do this?
No.
Okay. Very good. All right. So I'm gonna be listening to your lungs right now,
I'll keep your marbles.
and then asking you to take a deep breath for me. Can you take a deep breath? Very good.
Can you come back about like half an
Deep
hour?
breath. Very good. Again. Very good. Okay, I'm gonna go in the back now. Can you take a deep breath? Again. Again. Very well. Thank you. So now I'm gonna be feeling for perfection. Can you take a deep breath? A little deep breath. So I'm feeling the diaphragm, release. Very good. Thank you. And it doesn't hurt when I do any of this.
No, it feels
Okay.
good.
Very good. Okay, so this concludes your pulmonary assessment. Your lungs are clear, both lungs are clear, no issue whatsoever. So now we're gonna move on to the your GI, basically abdominal assessment. And then before I do anything, I'm gonna ask you a few questions. Have you been having any heartburn?
No.
Are you taking any medication right now to
No.
help with your stomach? Or would you say that you usually go to the have a regular bowel movement
I do, yes.
daily?
Daily.
And
Sometimes
no pain?
twice.
Good. And no pain with that, no blood,
No.
nothing? Very good. Okay. So have you had any surgery in your abdomen in the past?
Yes, I've had an appendectomy.
Okay, that's good to know. So basically you do not have an appendix. So I'm gonna ask you to lay down for me with your head on the bed and then your feet here. So first thing first, I'm gonna remove part of your gown. I'm just gonna observe your skin, looking at your skin. So for the sake of this video, I'm gonna pretend that my patient is naked. Well, not naked, but at least you're able to see her skin. But she doesn't feel comfortable being all naked, so I'm gonna just go ahead and pretend. Now, I'm looking at her skin, and I'm observing that both sides of the abdomen are equal, no issue whatsoever. One side is not upper than the other. The umbilical is there, no issue whatsoever. I'm gonna stand at the foot of the bed to make sure everything is symmetrical. Movement are symmetrical. Very good. So now I'm gonna palpate to feel if there's any abnormality like a lump, or is it tender, is it firm, does it hurt when I press on her belly, or anything like that. Okay, and I'm also after that gonna listen to vowel sounds to make sure that she has peristalsis. So basically her poops, or I should say stool, are moving smoothly through the intestine, to her intestines. Okay? Alright. So does it hurt when I do this?
No.
Okay. No discomfort.
No, no.
Very good. So I'm gonna listen to her bowel sound in all four quadrants, right? Upper. Bowel sounds are present in all four quadrants, and patient says she has no pain and everything seems to be normal. All right, thank you very much. You can sit down. Thank you. All right, so now we're gonna do a general skin assessment, starting from looking at your scalp and making sure that I don't see any redness, any tick and fleas. Well, shouldn't say tick and fleas, but any abnormalities or bugs or anything like that. and also looking at your pores, your skin. What I'm looking for is like uneven tone or things like rashes or any redness that you cannot explain, anything that hurts or burn or feeling tender. Okay? So, alright, we're looking. Look behind your ears, and then your neck, your face. Everything is monotone. I am also pretending that I'm able to see her skin completely, just so you know, and there is no redness, there's no rashes. She doesn't describe any form of abnormalities. Very good. Okay. Alright. Lastly, so I'm going to ask you a few questions about your urinary system. So, do you drink plenty of water?
About 4 glasses a day.
A day? That's it? Well, you probably need to increase that to keep your kidneys healthy. You need to drink plenty more water. So, when you urinate, does it burn? Are you having any pain
No.
upon urination?
No.
How would you describe your urine? What color is it?
It's concentrated but yellow.
But yellow. No foam when
No.
you pee? Foul odor?
No.
No discomfort? Okay, very good. And would you say you usually urinate on a regular basis?
Yeah.
Okay, very good. All right then. So with anything else regarding the urinary system, you would have to do certain tests that physically you cannot do, like laboratories, like a urinalysis or cultures or things like that that would tell us more about that system. So this is limited, except for asking the patient questions and also observe urine. If she did have urine, I would have to take a look to see if there's any, for example, sediments in it. What color is it? What smell does it have, and things like that. That would tell us more. However, we don't have that, but knowing the normal results are okay. All right, thank you very much, and that concludes our little session.